Hyperkalemia is one of the most important electrolyte abnormalities that physicians and especially nephrologists face in their practice by virtue of the risk of malignant cardiac arrhythmias that could happen with both low and high serum potassium levels. Now, this risk is borne out in part of electrophysiologic considerations and physiologic experiments, and also based on a number of observational studies that have typically shown a U-shaped association between potassium levels and outcomes such as mortality or malignant arrhythmias. Previous studies, however, have typically examined select patient population, for example, hospitalized patients or patients with certain comorbidities such as chronic kidney disease. And there are relatively few studies that examined the risk between serum potassium level and outcomes in large population-based studies and unselect populations. So we examined the association between serum potassium level and all-cause mortality, cardiovascular mortality, and end-stage renal disease in a large meta-analysis that included 26 diverse cohorts worldwide, the majority of which were population-based cohorts, and hence these results are applicable to the general population and hopefully to the entire world. We examined a total of over 1 million patients, and we indeed have found that serum potassium was associated with both mortality, all-cause mortality, cardiovascular mortality, and end-stage renal disease in a U-shape. And the best outcomes were observed with serum potassium values between 4 to 4.5. We were also able to examine these associations in a variety of subgroups, perhaps most importantly in patients with various levels of estimated GFR, to see if patients with more advanced CKD would indeed have a resistance to the effects of hypo or hyperkalemia. Perhaps to our surprise, we found no such differences in that the association between potassium level and mortality and ESRD was similar at all levels of estimated GFR.